Diseases outbreak in Penang ports are the lifelines of global trade. Every day, thousands of ships transport goods, passengers, and essential resources across continents. Yet behind this constant movement lies an invisible threat: infectious diseases. Ships, with their confined spaces and multinational crews, create ideal environments for illnesses to spread quietly and rapidly. At Penang Port, one of Malaysia's busiest and most strategic maritime gateways, a comprehensive system is in place to detect, manage, and control infectious disease outbreaks on board vessels. These efforts are supported by national legislation, including the Penang Port Commission Act 1955, Act 140, the Merchant Shipping Ordinance 1952, MSO 1952, and the Prevention and Control of Infectious Diseases Act 1988, Act 342. Alongside international frameworks such as the World Health Organization's International Health Regulations, IHR 2005. Before any vessel enters Penang waters, a pre-arrival health screening process is mandatory. At least 48 hours before arrival, the shipowner or master must inform the local shipping agent of the vessel's health status, last port of call, and voyage history. The shipping agent then enters all required information into Malaysia's Ship Clearance System, SCS, managed by the Malaysia Marine Department, MMD. This system automatically flags vessels that have departed from or transited through infected or high-risk ports, allowing authorities to initiate early risk assessment before the ship arrives. If a vessel is identified as having originated from an infected port or carrying suspected disease cases, the shipping agent must immediately notify the Penang State Health Department, Jabatan Kesihatan Negeri Pulau Penang, and other relevant authorities. Based on international and Malaysian health laws, the agent coordinates with the Ministry of Health, MOH, and the Penang Port Commission, PPC, to determine whether on-board quarantine, isolation, or inspection measures are required before granting entry clearance. Once the vessel arrives at Penang Port anchorage, the port health officer and port officer, empowered under Section 104 of the Merchant Shipping Ordinance 1952, may board and inspect the vessel. They assess the ship's health protection standards, medical care provisions, and hygiene conditions, ensuring compliance with the minimum requirements under Section 101 and Section 102 of the MSO 1952. These include verifying the Maritime Declaration of Health, MDH, reviewing medical records, and confirming the medical fitness of all seafarers on board. The Penang Port Commission, PPC, established under Act 140, acts as the regulatory authority overseeing all port operations and ensuring adherence to national laws, safety regulations, and international health standards. PPC coordinates closely with the Ministry of Health, MOH, Malaysia Marine Department, MMD, and Penang Port Stand BHD, PPSB, to facilitate inspection, quarantine, and clearance procedures. The PPSB, as the port operator, provides operational support by ensuring that isolation facilities, sanitation areas, and disinfection teams are ready. The operator also ensures that port workers follow strict safety and hygiene protocols during cargo handling, boarding, or disembarkation operations. Meanwhile, the Malaysia Marine Department, MMD, plays a key enforcement role by controlling vessel movement within Malaysian waters. If a ship is suspected of carrying an infectious disease, MMD may delay or deny entry clearance until the vessel is declared safe by the health authorities. This ensures that maritime safety, environmental protection, and public health remain uncompromised. Upon receipt of a report from the shipping agent or after detecting illness on board, the Penang State Health Department, acting under the authority of the Ministry of Health Malaysia, MOH, and guided by Act 342, conducts an official investigation. Health officers board the ship, perform medical examinations, and, if necessary, isolate symptomatic individuals. If the investigation confirms the presence of an infectious disease, the case is escalated to the MOH national level, which coordinates the next steps, including hospitalization, contact tracing, quarantine enforcement, and vessel disinfection. Under Article 6 of the International Health Regulations, IHR 2005, the Ministry of Health, MOH, as Malaysia's IHR national focal point, has a legal obligation to notify the World Health Organization, WHO, within 24 hours of any event that may constitute a public health emergency of international concern, PHEIC. This ensures transparency, rapid information sharing, and coordinated international response to prevent global disease spread. Throughout the process, PPC, PPSB, MMD, and MOH work in close coordination to ensure that the situation is contained swiftly and safely. The Penang Port Commission, under Act 140, ensures that all actions taken within the port are lawful, organized, and consistent with both domestic and international obligations. The Malaysia Marine Department enforces compliance under the Merchant Shipping Ordinance 1952, while the Ministry of Health leads medical and public health interventions in accordance with Act 342 and IHR 2005. To enhance preparedness, Penang Port regularly conducts simulation drills and training programs involving shipping agents, port health officers, PPC, PPSB, and MMD. These exercises ensure that all stakeholders understand their responsibilities, from the initial pre-arrival notification to inspection, containment, and reporting to WHO. This multi-agency framework ensures that infectious diseases on ships are managed systematically, reported accurately, and controlled effectively. The pre-arrival 48-hour reporting requirement, combined with digital monitoring through the ship clearance system, strengthens Malaysia's ability to detect potential health threats early. In conclusion, Penang Port's disease management protocol demonstrates a model of effective cooperation between national authorities and international organizations. Through coordinated enforcement of the Penang Port Commission Act 1955, Merchant Shipping Ordinance 1952, Act 342, and IHR 2005, Penang Port ensures the safety of its maritime community and local population. By keeping ports safe, Malaysia not only protects its economy and workers, but also contributes to global maritime health security, proving that keeping our ports safe means keeping our world healthy and connected.
Thank you for watching this video, and see you soon.